want to give birth without an epidural, but what if you need stitches afterward? Here are the options from a labor and delivery nurse who gave birth without epidurals and needed stitches afterward. So first thing to know, all tears are not the same. There are varying severity of tears. Some are pretty serious and need quite a bit of repair. Some are very, very minor and may not need any repair whatsoever. So the type of tear will kind of give you more guidance on what pain management tools may be the most effective for you and that sort of the repair. Number one, local anesthetic. Local anesthetic would be a numbing agent that your provider would draw up in a syringe with a very, very tiny needle and then inject it very superficially around the area where they plan to do the repair. And local anesthetic can be pretty effective. Number two, IV pain medication. If you have an IV in place, you could drop a medication and then administer a narcotic through your IV. Most people do find that the IV narcotics are pretty effective. Now, there are different types of narcotics to choose from, so it really is going to depend on your specific situation, your medical history, allergies. As with every medication, there are side effects, and common side effects from narcotics are oftentimes dizziness, sleepiness, nausea or vomiting, maybe a headache. Number three is nitrous oxide, which is laughing gas. This is an inhaled medication. It's delivered either through a tube or a mask, and it is patient controlled, meaning you are the one that would place it on your face, and then you would take deep breaths until you get the pain relief that you're looking for. Nitrous oxide absolutely can help blunt pain. It can even help reduce anxiety. Nitrous oxide is typically very short acting. It is out of the system literally within minutes. It is really good at kind of rounding off that pain, bringing the number down just a bit. These qualities can also be really great for a lot of people. Some people may only want a very short acting, light pain management option. Because it's inhaled, it's a really great option for a person who's looking for more of a non-invasive pain management approach. There are also side effects, nausea, dizziness. And number four, a spinal or an epidural. You heard me right. An anesthesiologist or a CRNA would access a space in the lower spine. They could just give medication into the space, and it would generally remove sensation from that mid upper abdomen all the way down to the feet. This is not something for minor or moderate tears. A spinal or an epidural after you gave birth is recommended if we have a really, really severe tear that requires intense repair. Now, this is not common, but as with everything, it's always a possibility, and it's important that you should know about it and know that your pain could be very, very well managed should that happen. For more information on pregnancy, birth, postpartum, babies, give me a follow, check out my page.